I just put this in the room?
Yeah. Okay, now. Okay,
1, 2, 3.
Huh?
Okay, you might have to go down behind me.
Okay, you go this way.
You want the bottle?
I think you can. Yeah, that's okay. We put the bottom.
You got enough room up there?
Yeah. Enough room? God bless ya. Good guy. Light out.
Labor-intensive project seemed to be the theme at the Great House as Garth continues working on the bedroom furniture.
Oh, I'm impressed. I'm very impressed. Oh, I like this.
We just matched the profile. I drew it freehanded on one side, we traced it out, flipped it over.
You're good. You're good.
Hi, this is evening report for Team 1 for November the 19th. In 602 bed 2 is Joyce Bone with CA the bladder with METS to hip and COPD. Joyce didn't have a very good evening tonight, continuation from days, I guess. Quite a bit of discomfort, but she was really reluctant to take anything for that at first. Her infuser is on time. The site is in her abdomen. She has a breakthrough site in her right thigh. At 1700, she does get a routine Haldol, which I opted to give subcutaneously. She was feeling a bit nauseated. She didn't have any emesis tonight. She ate a poor supper. She was up in the lounge for a bit. At 2020, I gave her Dilaudid 10 milligrams sub-Q for complaints of right hip pain, and she actually chose to go to bed at that time, which is quite different.
She likes to finish jobs.
Okay, Carmela.
Finish? This one has a
Joyce,
I'm gonna go to bed.
are you?
And
Do you want to go into the bathroom with me first, or?
No, I want a breakthrough.
You do?
Yeah.
I'm so happy. Joyce, can I find if you have another butterfly? I know you've got one in your tummy.
Okay,
That's
come on.
where
You
it's
have
gonna
to wait
go.
a little bit.
So that was it. And then this one they changed today.
Okay, you're coming back to me now,
So
Carmela.
I'll give you a breakthrough, and you want your bedtime pills now.
Okay,
And everything. You want to wait for your sleeping pill till much later.
over
don't
here.
you? Oh yes.
Okay. Can I have this hand? Okay, on your
Has this
side.
been here for a while? The Band-Aid?
Yeah.
You can probably take that off. Are they still staying away from the right
Yeah.
side? Okay. Are you still getting tingling or numbness or?
It's numb there.
Okay.
Yeah.
Carmela, you know your catheter here, the tube? I have to irrigate it. Okay? you feel that? Carmela? That doesn't feel bad? You can't feel that? What I'm doing? Does it hurt? No?
6021, Carmela Nordoni, C of the ovary, and non-insulin dependent diabetes. She has continuous oxygen at 3 liters. She denies pain, and her Foley was 100 this morning, and she's been turned and positioned approximately 3 times, and she was smiling, and support was given.
Jody and
Sure.
Phyllis around, please.
Doctor is here. Showtime.
Good morning, and how are you?
Good, how are you?
Good? Good. How was your night?
Not too bad. Not too bad.
Good.
A lot of pain in the evening. I took a breakthrough.
That helped? Yeah.
Somewhat, yes.
Yeah. Would you take something a little stronger? Because it's there for you if you...
Yeah, it's a little, I guess. I just don't want to go to sleep.
Yeah. Well, if you're having a lot of pain, then it's...
I was last night, but...
Yeah, yeah. What about that pain shooting down your leg? Is that any different?
No.
Not at all? Because we've increased the medication for that.
Well, it seems to come and go.
Mm-hmm. There was some discussion about a catheter for
Yeah.
you.
Somebody mentioned it last night.
Yeah, what do you think of that?
Well, of course, nobody wants them.
No, but are you finding being incontinent a big problem too?
Well, I can't get
To the bathroom in time?
the clothes off and on.
Yeah. So it might be worth giving it some serious consideration, you know? Might feel more comfortable and wouldn't have to worry about
Yeah.
that part of it then, you know? Might be more comfortable at night too.
Come sta? Ha detto Cristina che vuole spaghetti, te lo fa portare gli spaghetti? Eh? Sono fatto di su, dice che voleva la pasta. Vuole la pasta, te la portano poco stasera?
Stasera avevo qua andavo.
Se vuole la pasta, te la porta domani.
No, ora basta.
E che vuole? Nothing?
Nothing.
No?
Has your own priest come?
They told me that she received her last rites. That's what I was told. And she said, I asked her, like, if the priest had come, and she said yes. So I really don't know, because, like, I asked for one when I was talking to the doctor, and he says that's no problem. And then I asked her if the priest had come, and she said yes. So
But
presumably,
maybe she'd like to see one now. Has she had the sacrament, you think?
she had communion. Like Tuesday, she didn't have it.
But she didn't have communion this Tuesday when
No,
Sister Leonie was here?
no, because she had just come out of the shower and she was really exhausted.
Okay. Yes,
Yeah.
of course.
So she didn't have it this Tuesday, but last week I believe she had it.
Let me ask her if she
Yeah.
might like to see a priest, because
Yeah.
I would get him from Our Lady.
Yeah.
Carmela. Hi, sweetie. Would you like me to get a priest to come visit you?
Vuole prete, ma?
Your priest?
Yeah, it's okay. It's okay.
You think she'd rather not? Is that what you're saying?
She just says it doesn't matter.
It's okay. So it would be okay to call him?
But would he be Italian speaking?
I could ask for that. Yes, yes. I will get a priest that speaks Italian for you, okay? You know that I pray with you.
Okay.
And Carmela, you know that God is with you? Yes. Okay, I will call the Italian priest and he'll come and talk to you. God bless you. How are you doing?
Trying to cope. What are you gonna do? Like, you know, sad.
It's not very easy, I know.
No, it isn't easy. You know, just waiting for the inevitable to come, like, you know. Or rather, it would have been a surprise, like, you know what I'm saying?
Yes, we don't have a choice though.
We don't have, no,
We
there
never
is no
have that
choice. As long as she's not in pain.
No, I think she's quite comfortable.
Yeah.
And when she does leave us, she will leave in peace. We will
Oh, well,
all.
she will leave in peace because, like, you know, she's a good woman. She
Absolutely.
never harmed anyone, just quiet woman, always tending
Beautiful
to the
lady.
family, yeah. Like, it never complains. Even if she's in pain, she will not complain.
No.
Hi, this is evening report for November the 20th. In 602 bed 1, we have Carmela Nardoni with CA the ovary, non-insulin dependent diabetes. Carmela seemed to have a better evening tonight. She had numerous family members in tonight. She ate fairly this evening, and I just gave her a routine HS sedation. 602 bed 2 is Joyce Bone with CA the bladder with METs to hip and COPD. Joyce is actually having a better evening tonight. She's in much better spirit. She's joking around quite a bit this evening. With regards to her pain is still low.
Pad wasn't even wet. So it must have not fit and ran down the sides.
Was it urine?
Yeah.
Yeah.
It's the only thing I can do.
And you didn't feel anything?
No, not until I got up.
No.
As soon as I stood up, I did.
Well, don't let it shake you, okay? Because it's not going to change anything.
No, I know it's not going to change anything.
But you should have called me and I could have helped you, so, because you use up a lot of energy by changing and stuff.
Well, I managed and got
I know.
separate underdoors and whatever on, you know.
Yeah. I know you like to be independent.
Well, it isn't only that, it's embarrassing as well.
Really?
Sure.
I don't even look at it that way.
Yeah.
Is there anything else I can do for you?
No.
Okay.
I'm fine.
So I'll see you in a little while.
Okay.
Just holler if you need
I
me.
won't be anywhere. I'll be here.
Okay. Take it easy. You're okay, Carmela? Okay. Bon appetit.
You know, you can be close to God and
not be in church.
Not necessarily all the time.
You can be close without.
And did you feel close to God?
No.
No.
I must be honest, say no.
Fair enough. And did some of the things that have happened in your life, is that a result of that? You know, I know that you lost your husband and lost your child.
I lost 2 kids, my family, my husband.
2 kids?
Yes, my daughter too.
How
my daughter
old
and
were
my
they?
son. My daughter was a year old, my son was 21.
Wow. That's a lot of loss.
My mother, my brother, my father, all in 1 year. So I felt at the time that there wasn't anything I had to thank God for.
I can imagine. I can imagine.
My daughter first, she started the string.
That must have been overwhelming for you and your husband.
It was.
But you did get through it. You're a strong person.
Well, fairly.
I think you're a strong person. And then you lost your son.
Yes, he was killed with a drunk driver.
I'm just almost speechless.
Well, it was at the time.
Yes.
Just
for you and your husband. You probably supported each other, I would think. He was still living then.
Time, yes.
You didn't totally give up.
No.
Because you certainly survived and made a new life for yourself in some ways.
Well, I just went like before, day by day.
Yes. And now to find that you have cancer yourself.
I'm not handling it very well, I don't think.
Can you enlarge on that a little bit?
Well, I'm letting it get to me where I shouldn't.
You want to be strong right to the end.
Yes, I do. I could go and sit in a corner and cross my legs and stay there till the end.
Is that because you feel weak?
No, I just feel finished.
Well, it's really, really nice to meet you.
Thank you, you too.
Yeah, I'm Phyllis.
Okay.
Your name was what?
I'm Kathy.
Kathy. And you're a friend of...
I'm a neighbor.
A neighbor.
Yeah, I'm a neighbor. For the last 35 years, we grew up there.
Oh, wow. So
Carmela.
you're pretty close to
We're very
Carmela.
close.
It's almost like a grandma.
We went through all the deaths together, yeah. My father died, and my father and her husband were best friends. Her husband passed away.
Yes, right.
My son was very attached to her husband and her, because they took the grandparent figure when my father passed away.
Isn't that lovely?
Yeah, it's beautiful. We've been there. We're more like family.
And it probably will draw all of you as family
Oh,
closer
yes.
together. And
One more time.
one more time.
We take care of each other. When my father died, Carmel and her husband would visit my mother-in-law, give her words of courage.
Yes.
And my father was a lot younger than them. And it was nice to see my mother. Actually, you know, she took to them well because they really understood. They're all from the old country.
Yes.
They all settled here and all had to work really hard and immigrants. And we can't understand because, you know, we have everything, but they suffered, you know.
Oh, I know.
And I'm sure they
Maria.
did.
Maria was telling me that Carmela worked
She
hard.
did. She worked
all her
very
life.
hard. I remember.
Ever
She
since
did.
she came from
That's
Italy.
right. And it's always to provide for the family and
Right,
families.
years of picking tomatoes and all kinds of things. She
Oh,
said,
God, they
to,
did
to make
everything. They
enough
did.
money to get by.
Right. She was a good person.
6021 Carmela Nardoni. We have noticed quite a change with her. Christine established a butterfly in her right deltoid, and she had the alternate root F105. We also noted that she has weeping edema. We did not notice any diaphoresis, but the weeping edema was in her legs. She's verbally responsive, so you might want to call the family.
When we were doing her care?
No, what I did notice that when you lift her leg felt a little more pliable, like squishy.
More edema.
Yeah, more. There was more edema. My nails actually, my fingertips went.
Okay, so now night she's.
602 bed 2 is Joyce Bones.
Okay. Now, Joyce Bone. Yeah. See the bladder bone, that's hip. We've moved her into 604 bed 2. She's okay. She continues to be reluctant to take those breakthroughs because of her drowsiness. Right. So we started her on Ritalin. When did we start her on Ritalin? Was it over the weekend? Yeah, it looks like it. Yeah, we started on 2.5. Well, just 2 days ago. Twice. Is that 2.5?
3 days ago.
Okay. Yeah. So, and then yesterday we increased it to 12.
That just needs to clean the stools.
Yeah.
Here we go, Joyce. You are at the window.
Now, how are the mornings?
Morning, I'm somebody else or something else. I can't seem to get it together.
Yeah. Are you waking up during the night?
No,
Not at all.
not usually. Not till around 6.
Yeah, you're taking a pill at night. Maybe if we make that half.
No.
No? Okay. Okay. It's up to you.
I want to
was just-
sleep.
Yeah, sure. It may. I think when you came in first, they offered you a half, and then you graduated onto a whole pill. I don't. It's one of the better ones, so I doubt if it's leaving much of a hangover. I think it's much more to do with the illness. You know that. You feel a little bit less alert in the morning. Has that always been a case for you?
No, it's just been this last 2 or 3 days that I've felt stupid.
No, I wouldn't use that. I wouldn't use that word for you ever, Joyce. You know,
Well, that's
you're
what I
not,
felt
you
like.
feel, yeah.
I felt like
weren't-
that I didn't know what I was doing, that I was stupid. It's the only word I could think of.
That's okay. But then you feel okay after a while.
Yes, later on in the day, after the girls get working with me and I don't hear them right, I don't see them right, I don't understand what they're saying. I just feel dense.
Hi, Maria. Hi, my name is Allison. I'm one of the nurses here at the Toronto Grace. I'm looking after your mom this evening, and I just thought, you were in yesterday during the day? You were in last night. After you left and sort of throughout the day today, we've noticed a little bit of change in her breathing. She's not in any distress or anything, but she's starting to get a little bit congested. Yeah. And she's not really taking that much in, but we just wanted you to be aware that there's been a slight change. I mean, it doesn't mean that anything's imminent or something's happening right now, but just so that you're aware that if there is
What are you doing? These are not our. This isn't ours. Get rid of this. This belongs next door. All this paraphernalia. And what do you want to do? Can I help you with anything? You want to get up or do you want to lay down for a while? Why don't you lay down for a while and rest, eh? And then maybe you could get up after. Get rid of this.
Spilt the coffee.
Oh, well, they're going to have to change it before you get up. I think this young lady wants to get up.
You do, eh?
Yeah.
Okay. I just came with
That's going out or coming in?
This is coming in.
1, 2, 3. Okay, Joycey.
Good evening. This is the night report for Sunday, November the 24th. 602 bed 1, Carmelo Nadoni, C of the ovary with diabetes type 2. Her Foley drain 50 cc's, treatment of the CBI was 400 and to run through is 500. Her condition remains poor and she is very diaphoretic, a lot less responsive, and her condition is deteriorating.
Haldol works on nausea. If your brain is telling you that you're going to feel sick, it'll help sort of hopefully stop that. Do you want a tablet?
Because the doctor said not to eat, not to try and eat.
Small portions.
Just little bits.
Just little tiny bits because it's too much of a shock, I think, on your system. Eat a little bit and let your stomach rest. Eat a little bit more, but don't...
And that's what she told me, just
Yeah.
eat little bits.
Yeah. Joyce, do you want it in the needle form or do you want it in the pill form? It works faster in the needle form.
Yeah,
In your
okay.
Okay. I thought he was oriented in your foot up here. No.
Okay, madam, ready?
No, I'm done. Okay. All right.
On your way.
Okay.
Now you're set.
Almost anything.
Oh.
I hope so too. No, just for her tummy. Her stomach's been bothering her today.
Are you going back in bed now, Joyce? Or not yet?
No, I don't want to go back to bed.
Okay, wait up for supper.
And the girls have gone home now, Carmela. Okay, they're just waiting in the lounge to go. Just relax.
Glue this foam on. Then we're going to trim the foam to size to match the frame. Yeah. And then we wrap the back, and then we upholster with the fabric. So let's try and get this done.
And we can go home.
too. You want to get them?
They went home.
Oh, did
Yeah, they went home at 4 o'clock.
Okay.
Just do that. Okay, Carmela.
take the catheter out too. I don't have much here. Okay, I can slip. Are they coming back in or?
I'll call them.
Okay. They look really peaceful. I'll come back and take that catheter out.
Hi, Maria. It's Christina calling. I just wanted you and your children to know that Carmela, she passed away just about within the last 20 minutes. Very peacefully and quietly, just the way you left her. There's just a couple papers to be signed and also her personal belongings. Would you be able to come in later on today? This is Christina and the night report for the 25th of November. Carmela Nadone CA, the ovary abdominal mets, type 2 diabetes. Her family was in and decided to go home at 4 o'clock this morning, and she passed away peacefully at 5:50 this morning, and she was pronounced at that time, and postmortem care has been done.
Carmela Nardoni came in October 30th and died November 26th. All of these are quite
All
short.
of them, yes.
Yeah.
She was lovely.
That was very fast at the end.
At the end, yeah.
Yes, yes.
What about her daughter? Did she come?
She came at least pretty nearly every other day, and then
Right.
she was here a lot at the end, and
Yeah.
was here that evening.
Didn't Carmela make the choice or decide with her family that she didn't want them at her bedside?
Yes.
She did, right.
Yeah.
They went home around 2
4,
in the
was it? Oh,
morning or
2.
3, and yeah, because she didn't want them there when it actually happened.
.602 bed 2, Joyce Bone. She was aware of Carmela's deterioration in condition, but she has not yet been notified that she's passed away. If you could do that on days. She slept peacefully most of the night.
Boxes down there, so I'll see. How's that?
That's good. I don't believe that there's an afterlife.
So, after here?
Yeah.
What do you think? If there's no afterlife, this is just kind of the end of everything?
Yes, I think so. The end is the end is the end.
But you'd like to believe otherwise?
I'd like to believe, but I don't.
What is it you would like to believe?
That there's something besides just this.
This life that's been so full of pain and
That there's
suffering
something else.
and loss for you. You lost your mother and your dad and your brother. And then your dad's death wasn't...
He did that himself.
He committed suicide. Is that what you told me?
Yes, he shot himself.
So what a shock that was to you. I'm not surprised that you feel anger.
The CBC was done today. Her left leg is bothersome. She had some Tylenol playing at bedtime. And on nights she had no voice complaints. But she has reiterated that she doesn't want any calls or visits or flowers from anybody. And
I hear what you're saying. Like I hear what you're, how you feel about it, for sure. I'm just.
When my brother-in-law received this, he says, "How did she ever get my address?" And I said, "Well, I'm going to have to ask here, but I know that no information is given out."
Do you want to talk about it some more? Because I have questions. We can leave it if you want.
No, you have questions. You go ahead and you can ask me.
Well, I just. What is it? What does it mean to you when she writes that?
That she's invading my privacy.
And when
because
she said
I would have given her my address. See, if someone wouldn't give me their address, I wouldn't go calling the pension board asking for your address. Because I would understand that she didn't have a return address where I could write to her. She wants to send me flowers. Well, I don't receive any calls or any visitors or flowers. You see, I just don't want that. But she went ahead and...
Why is it okay for your brother-in-law to care about you, but it's not okay for your friends? It's a big question.
Well, yeah, it's a big question. I've known my brother-in-law for 49 years.
Yeah?
He was taking my twin sister out for 2 years, then he got married, and he's been married to her for 47 years. He's like a brother, you know?
Family's different?
His family?
Is family different than friends?
In this case, yeah, but not all family is our friends, you know? Yeah. Oh, he is definitely. I can trust him, and I always trusted him. This is only an associate that I worked with. It's not a person who has become a friend, but I know she wants to become a friend.
She's interested in you?
Oh, yeah, but I have to...
Does she care about you?
Well, I think she does.
But she's not...
She won't like that, but I don't want to associate with her. Otherwise, she would have been my friend long before now. You know?
I heard a bit.
What did you say you heard a bit? You want some more? You want a little breakthrough?
Oh, no,
Tiny, tiny breakthrough. Just a little bit. I don't want you to be in pain, though. If we just gave you a little amount, not enough to take a little bit of your pain away, but not enough to make you too drowsy, you'll be more comfortable then, Joyce, so you can sit up and maybe have a smoke.
for that.
Okay, right. Did I sell you on that?
Yes.
Excellent. Excellent. I'm gonna go get you some pain medicine. I shall return.
Okay, so if you need anything, just let us know.
Yeah.
We'll organize.
Well, my
Chinese,
brother-in-law is
whatever.
coming, and he says, make a list of what you want me to bring.
Oh, is he coming?
Yeah. Yeah. He just comes for the one day, though, you know, because he's coming all the way from Windsor. He takes the train in. But I don't want him to be hanging around here, you know. It's too hard on him. And you know how men are sometimes. You know, they can't cope as well. He can cope, but he's been through so much with my family, and
Yeah.
he just lost my sister in January, so you know he's still getting over that. And then now me. But I don't want to be coming down. You know,
If he enjoys it, if he wants
it's
to
too
come.
hard on him. It's too
Taking the needle out.
We're gonna take that one out. And I wanted to go here, but we can't go here because your medicine won't absorb there. Where are you going on Saturday? Rumor has it you're leaving.
Pardon?
Are you going somewhere on Saturday?
Yes.
What are you doing?
I'm going to a Christmas banquet.
Is that at your building that you're in?
Yes.
This is nice. So you'd be out overnight.
I'm not going till Saturday.
Yeah.
And I'll be back Monday morning.
Okay. All right. I
So it's weekend.
always miss you when you're gone. My friend, you're finished.
Yes.
Here. So what we'll do, we'll stand you up, we'll pull your pants up, and then I'll pin this to you up here.
Okay.
How's that sound? Do you want me to do the hug, Stan? Give me a hug. There you go. You hold on to me, okay? Because I'm going to hold on to your pants. Give me a hug. That's it. You smell really good, Joyce.
Okay, the right wheel. Go ahead. Good.
You're going to shake yourself.
Good. Good.
Sounds so great.
Fine. Over here. That's good. That's it. That's it, little. Right. Way to go. Way to go.
Or you can do your left.
Yeah.
Just let go of the right wheel, Joyce, and just turn the left wheel.
Way to
There you
go.
Joyce.
Way to go. It's like driving a car. It's for you. Good. See how easy it is?
I do it not too well, but I do it.
Sure you are. Please trust this.
Well, it's interesting to be here, back in beautiful downtown Toronto. Go to Mellon's this afternoon, have a cocktail, say hello to my friends.
That's good. You'll need one by then. You sure you don't want something?
No, dear, seriously.
I was going to mention something. I can't remember everything. Maybe I should have been writing things
Elaine
down.
at work said to say a big hello.
Oh, well, you say hello to them.
And it was her husband that did the fireplace.
Now, the mirror on the side of the fireplace, where did you put that mirror? Because it shouldn't be
Well,
there.
if you want the mirror on the foyer, in the foyer.
Yay, in the
Yay.
foyer.
Yeah, yeah.
When they come in or you leave, and you
Yes,
look at
yes,
it. So what did
yeah.
you do with that painting?
It's gone.
Or is it a photo?
It's a
is
real
picture?
painting. No,
It's a
it's a painting. Yeah.
Oh, it's gone.
Yeah.
Okay, so you've got a mirror there over the. Okay, that all looks good.
And my
That's
new
all
little
fine.
table.
Yeah.
And then I got a stand-up lamp underneath the big mirror in the dinette.
604 bed 1, Ida CMAC with CA of the breast and liver mets. She's to be reassessed at Mount Sinai, and I don't have anything further on Ida, but she had her usual day and she took her meals well.
Is this your first time out of the hospital?
First time on the street since June the 16th.
Oh, so this is a big excursion, huh?
Yeah, it is. One of the staff said that I should go out for a ride, and I thought, oh, I'll be bumping into all my neighbors.
Well, what's wrong with that? Now that you've got
They might not
your hair
recognize
back.
me. Oh, no, they wouldn't recognize me, I can assure you of that.
Great.
Hi, Edwarda.
Hi.
How are you? Good. How lovely to see you.
Same here.
Oh, that's wonderful.
You cut your hair shorter.
Oh, I guess so. This is a surprise. Well,
you're still
lovely.
here.
Yeah, I'm
I'm
still
thinking
here.
about you
yeah,
girls
and
all
so
the
are you. That's what's so wonderful. You are? What
do.
Velita and I do. Well, I saw your name on the list, and I said to Velita, "Is this a mistake?" She said, "No, I knew you were doing okay," and I was laughing. But I guess I've got to go back to see the other patients. But it's lovely.
Yeah,
It's
same
just
here.
beautiful to see you, Edwarda. Really lovely.
So I was surprised the other day when your doctor called me and said, would you like to see a friend again? And I said, sure.
Yeah, he told me Saturday he was talking to you.
So, can you tell me now about how you feel?
I have no pain. I've lost quite a bit of weight. I think about 30 pounds since I was last here. I'm eating well. I started to walk about 2 weeks ago. I'm doing a bit of exercising for my legs. Everything seems to be normal.
You've seen the patients around you pass away.
And in a lot of pain. Mm-hmm.
Has it been difficult for you in the hospital at all from an emotional point of view?
No. No, because I think I'm prepared for all that.
What is your expectation for the future? Do you have any
My expectations? My expectations are to get better and to get on with my life. And if I have any tests and it doesn't go that way, then I can face what will be next.
Do you see yourself getting out of hospital?
Yeah.
Yeah.
I got here.
Yeah. Yeah.
Joyce is deteriorating quite a bit. She's really hard to rouse. She's really drowsy. Her ambulating and her mobility is really decreased now. I mean, she has to get going though.
So she's going home
You need to
Saturday.
really sort of
She's
be...
going home.
Saturday.
Going home for the big dinner.
She said it's an open bar. She's
Yeah,
very happy.
and she said, I know I can't dance, but I probably will wiggle.
Just with a great sense of humor.
You look fresh this morning.
Well, I've been scrubbed from top to bottom.
It's take a lot of effort, maybe, from you, but at the end, you know, feel good. Oops. That.
Bed 2, Joyce Bone, CA of the bladder with bone mets and COPD. She's going out on pass after supper today.
Can you just stop for a second?
In her room, I've passed on to Dale, but in her room is a bag. Because I had suggested last night that they put on a dressing for the weekend, like in a leave-in or something, and they said no. So what they've done is put the Telfas, some saline, and some 4x4s in a bag in her room, showed her what to do. I don't
So
know.
much
I don't
fuss.
know.
So much fuss.
She's got a brief in her purse too, in case she
Yeah.
needs to go to the
Julie's got all the information.
Okay.
Okay. Have a good time.
Thank you.
Okay, thank you.
I hope to.
Are you okay now, Joy?
I'm fine.
Joy, come and Joy.
Goodbye.
Well, then you're going to have to decide what to do next.
If I come in for chemotherapy, I live alone, so I've got to do a lot of thinking. You know what I mean? That's the problem. But
Well, you don't
I
live
can
alone
always...
anymore, kiddo.
Well,
you have lots of roommates.
I may not be at the hospital. I don't know. You see.
Oh, there's a chance that
I might be discharged. You see.
Wow. Where would you go though? You've given up your apartment.
Oh, I would get myself a condominium or.
You'd rent a place.
Rent a place. Oh yeah.
Where's all your furniture now?
Well, I've got to find that out because I thought he gave it all away, but it doesn't sound like he gave it all away. If I'm going for weekly therapy, then,
well,
like, do I stay at the hospital? I don't stay at the hospital. That's my concern. Are we here already?
Hi.
What are we going to just like?
By the window, so let's go in. Head first. Go in head first. Head first.
Joyce.
And yeah, we're gonna move you over. Ready? 1, 2, 3.
Whoa. Thanks very much
Are you
for
comfortable?
going so
Oh, no problem. What can we do? Okay.
You get up. Thank you. Hi, Joyce.
Hi.
The cheap furniture now.
Nice to see you. Nice to see you too.
Okay, Joyce. Hold on. Let me put the bed down so we can move it.
You got that? So the family member that we spoke to,
Daphne?
yeah, she said that her level of consciousness has decreased quite significantly.
Okay.
She hasn't been able to eat
hasn't had
anything or
anything?
swallow anything today.
All right. Okay.
And she's having a lot of difficulty keeping her awake. Apparently, the last time she had her meds was last night. Okay.
Thanks very much.
No problem. Take
Thanks
care.
a lot. Hey, Joyce.
Hmm?
Ahead of it. Yeah.
See, this is Motilium here. 2 Motilium and a Haldol, and the valproic acid she gets at, between 11 and 1.
Yeah.
Okay,
Yeah.
so that's what she would get, but there isn't the Ritalin.
Okay.
Okay, and see here, let's see that for the HS sedation, she took 7.5 and the 3.75, so she only took 7.5.
Yeah, and nothing at all today?
Nothing, no.
Can you look in it and tell me how many are in it, please?
No, she told me quite clearly. She says, I was afraid at home. And I said, what were you afraid of? She said, I was afraid that I would have pain and wouldn't be able to,
Hi.
stand it. And
So there's 2 left, so she took 3 last night. Okay, and just 2 left. Okay, thanks a lot. Okay, thanks. Bye. She took the 3 of them last night. She's had none today. And Daphne says there's 2 left in the brown envelope, and she's put them in her bag, and she'll be here shortly, she said.
Okay.
Yeah. But she says, no, it wasn't today. It was last night she took them. So she said nothing today.
So she's been uncomfortable.
Just going to take a look at this in here. Disturb her.
Oh, I love you.
Same here. You've been busy this morning.
Yeah.
Good for you.
Well, thank you.
Good for
I
you.
thought I really should get to see people, and some have been here for weeks, and I haven't been to see them at all.
Some, a lot of new ones. See the 2 buddies here?
No, I don't know those folks.
No.
Don't know them. But, so are you going at the end of the month, or what's?
Who knows?
Yeah.
I'm going for my CAT scan Monday.
On Monday? Okay.
So we'll work it from there.
Yeah.
We'll see what happens.
So listen,
That's a
hon.
nice idea.
I'm going.
Okay.
Oh,
We'll see you next week.
Yeah. I'll see you
Next
next
Saturday?
week.
Yeah.
Next Saturday?
Yeah.
Merry Christmas.
Same to you.
Love you.
Take care.
Okay, hon. Take care. Bye-bye.
Bed 2, Joyce Bone with C of the bladder and bone mets. When we first came on, she had indicated she needed something for pain and shortness of breath, and she was able to verbalize that. Her congestion and respiratory difficulty was obvious at that point, and Joyce's respiration ceased at 09:35. In the end, it was a rapid decline with respiratory distress and then a peaceful last breath.
had quite a few weeks, haven't you? How do you feel about it all?
I mean, the changeover and, well, we're here for a purpose, and you know, people are dying. You just don't know when, and you sort of expect it, and you know, it's just like the nurses here, you know, you just don't know when it's going to happen, but it's inevitable. And when it's your roommate, and you're ready to accept that, I think. I am anyway. You know.
Is it preoccupying you a lot?
No.
No?
No. I'm sort of thinking of doing it day by day. If I hear from them, that's fine. If I don't, I'll wait and just, you know, but it's not really occupying my mind or where I'm worried or too concerned at all. No.
Is the outcome preoccupying you?
No, because I know that it's there.
Yeah, yeah.
You know.
Yeah.
So whether...
How do you mean you know that it's
Well, the cancer is still there. You know, I don't expect it to be gone because it's an organ. But whether it's gone further or whether it's gone not too far or more aggressive, I don't think it really makes any difference. Except that my oncologist wanted me to have some more chemotherapy, but a smaller dosage on a weekly basis. But, you know, I haven't made any decisions yet. I think I know where I'm going, but I don't know it. I don't know yet, and I'd like to hear him and, you know, see what options there are.
Yeah, yeah.
Good morning, man.
Let's go to the sunny side. Well, Susan's got a pallet here. Look over there.
As I was telling the social worker the other day, I think I can't get out of this nut house. I think it's driving me crazy.
Oh my God.
Of course, her hours was a little boogie.
So you're gonna have to go live. Okay? I know. That was priceless.
Have a nice day.
Hello. This is a report on Richard Pollard. His diagnosis is squamous cell lung cancer. He's hepatitis C from old IV drug use. He's not had radiation. He declines that. He says, oh, I'm going to die anyway. And chemotherapy, his last treatment was last week. He's had a fascinating life, actually. From high school, he joined Satan's Choice. He was homeless for a bit. He has been employed. But he says he's made a complete turnaround. And I think part of it was the folks from the island just taking him in.
About your nice picture.
Yeah. You can stick that
In the window, right?
in the window, yeah.
Okay. And let's see what kind of papers are these. I brought you some coffee crisps to bribe the nurses.
Yeah.
And I found the knife you mentioned. It looks really good.
That was my hike-a-diddle knife.
Was it your roast beef knife or your self-protection knife?
My social knife.
Your social knife?
To make the people become social.
Yes. Well, I'm glad I wasn't on the wrong end of that. And I found this. It looks like somebody returned a borrowed bottle from you. This is sitting on your landing.
I'll sit that down here.
All right. Your favorite brand of
Otherwise, you think we'll run the
all
booze
those years
can
you
here.
spent outside, Rick.
Yeah.
You've been a lot of tough winters.
Yeah.
Well, it felt kind of sad to be in your house, I have to say.
Oh, it's sad to leave it.
It was sad to
Right.
say, no, I don't think Rick's not coming back to live here.
She's gonna be sad that I didn't pay the month's rent. But,
Yeah, but they'll probably get somebody in there pretty quick.
oh yeah.
So your two housemates said they would divvy up your stuff and they wouldn't fight over it, they said.
Well, as long as it don't get thrown out in the street, you know. 'Cause I got a lot of mileage on those sleeping bags.
Chew it and swallow it. You've got to chew it or the nurse will come.
Yeah, come on, where's my dirty look?
That's it. Let it come up. Good boy. That's all right.
That's good.
Don't give him a dirty look now. Have you swallowed that? Okay, open up again then. Gee, you slept all morning.
You had a rough day, didn't you? Hey,
What were you doing last night?
party too much. Hmm?
No church tonight. No
In
church
602 bed 2, Lloyd Greenway, mixed glioma and pulmonary embolus. He had some nitroglycerin spray for anterior chest pain at 11:45. His color seemed to be quite good at that time. His pulse was 76. He had the oxygen going continuously and it was with good effect. He's had family and friends in to visit, and he's in a very playful mood today and hasn't had any sort of tearful episode.
You wear your new watch already? Okay, Loy, if you get tired, you tell somebody, okay? So they're gonna bring you up. That's the boulevard. That's nice. Yeah.
Britain. Did you Britain House. really? And this morning on the way down, I stopped at the Claremont. In fact, they're both probably opened.
So they're really new. That's
yeah.
interesting.
Now this is Britain House.
Mm-hmm.
See, this used to be the old hotel right at the corner of
Oh,
Sudan
yeah.
and Mount Pleasant.
Oh, and there it is.
Yeah, see, this is the pool on the roof.
Wow.
With this huge, you can see this huge glass dome. They have a swimming pool.
Mm-hmm. Hairdressing.
They have a hairdresser, yeah. So I thought you'd be interested in that.
Yes.
Since you're kind of
Yes.
looking around. But to me, it seems that this kind of apartment would offer you more
I think so.
in terms of care. If
Oh,
you're,
yes. This would.
so you got lots of plans.
Yeah.
This
I
works
thought,
out. That's
yeah.
great.
Oh, yeah. To do a lot of explanation because I think I'm on my deathbed.
Your
Yeah.
friends?
Yeah.
You know what? You were when you came.
I know. Well, they know that.
So you don't have to explain so much. You just need to say I
Yeah.
improved as
Mhm,
the months went on.
But I haven't written notes or said that, and I didn't send any Christmas cards because I just lost my sister, so I didn't think it was appropriate to send Christmas cards. But Gord's going to bring me some New Year's cards, and I thought that's a little more appropriate, so I can send those in January when I'm up to it.
Yeah. That's a good
Maybe I'll
idea.
make a little, write a little memo or something. I don't want to get into too much detail because I don't know yet,
Oh, I'm so glad that you're going to start connecting with your friends out there.
Oh, definitely. Oh, yeah, I wouldn't want to lose them. No.
612 bed 3, Rick Pollard, CA of the lung with hepatitis C positive. Sue talked with Rick regarding his smoking at nighttime. We don't want him to go outside, especially with the elevators being wonky. He understands this, and he says sometimes he feels a little bit edgy and that the smoking helps. He's had a breakthrough of Percocet, 2 tabs of 11 and 1300, and it looks like he's had a couple of bottles of beer as well.
No problem.
And
Here, I took my mouthwash here.
Wendy's gonna bring you a beer.
Yeah, okay.
I'm gonna put the foot part of your bed down because you're up on an angle here.
I've been on an angle all my life.
Yeah.
Yeah. Either pull on an angle or,
Mm. Okay, hold on, I'll go get it. Here you go, your cocktail, sir.
Thank you. Take a few sips of this with this first before I spill all that.
Okay. You can drink, you want to drink it out of the can? want you to. You ring your bell if you need me, okay?
Yeah, okay.
All right.
Norm, you and I spoke yesterday.
Yeah.
And I think what we're trying to do today is just talk about Lloyd's, what you wanted to know is his prognosis, and really what to expect.
What are we looking at here?
Yeah.
You know.
There's always the outside chance that things can happen fairly quickly. It's not the more usual way, but it can happen. Time-wise, that's why it's very difficult to say exactly how long it is. Really, as hard as this is to do, the best thing to try and do is to take it one day at a time. That's much easier said than done.
Okay.
But unfortunately, it's a very bad disease, and it's you know, it's taking its toll.
Yeah. I can see it happen faster.
Yeah.
I really can.
Yeah. Yeah.
And
Yeah, it's a difficult time, Norm, but we're here for you, to support you. And if you are able to take some time, now is the time to be with him.
because I think he's ready from what he said this morning.
Does he talk about dying with you?
This morning he did. This is the first time. He's sitting there with his finger like this.
Yeah.
I said, what? He says, be God. He says, I'm going to God.
Was that a hard thing to hear?
No.
No. Was it a comfort to you?
Yes.
Yeah.
Made me feel much better.
Yes.
Because there's been a problem. I don't know with his mental state, because I mean, he's preached for years. Yet when it come to the time, he got afraid. And that's what scared me more than anything. And yet today, quite comfortable. And I said to him, don't worry about it. He says, but you're going to be here. And I said, yeah. I said, but don't forget, I won't be long behind you. You know, and he says, don't do anything stupid.
Palliative-care, Howard speaking.
And there's Rick. Rick has come out of his coma. Apparently when he came, when Sue was arranging his admission, he wasn't going to last the day, apparently.
You're kidding. What is that true? When he was coming in, he was so poor he wasn't going to...
They told me he wouldn't last a week.
Oh my
He
God,
was
he looks
having
great.
some sort of crisis, but he's come through it.
He does.
He's still on the Percocet. He's had a number of beers. He's had his Percocet 2 tabs twice on evenings, and then on nights he had a beer, some Ativan, and Percocet 3 times.
Percocet as in breakthrough, right?
As in breakthrough.
In addition to his long-acting oxycodone. Okay.
Yeah.
But he likes his Percocet.
He likes his
I don't
Percocet.
think we need
Oh.
to...
Okay,
It
so he
doesn't
just...
matter. I think he's always going to have
Okay.
Percocet,
So he's not
beer,
having
and
more pain.
cigarettes are his main.
So that's why he thinks he's died and gone to heaven.
Right.
Since 1 o'clock he's had
he's ever been.
2,
And he's been in a
4,
lot of
6, 8, 10 Percocet.
Okay.
Yeah.
How's your breathing feel?
I'm having a tough time on one side. It seems like there's a big plug of dough hanging in there, and it won't come out, you know?
Are you coughing?
Well, I'm trying to cough,
Yeah.
but it don't come out.
Yeah.
Like there's no phlegm or nothing,
Right.
you know?
You've done pretty well since you've been in here, though. You were, not so great the day that you came in.
Well, what happened there was I was at home,
Yeah,
right?
uh-huh.
And I was ODing on my drugs. Like I'd lose my senses for a while.
Right.
So I was losing the count.
Yeah.
Like I didn't know if it was Monday, Tuesday, Wednesday, or what
Right.
time it was.
Uh-huh.
So I forget when I took my last drugs.
Yeah.
So I might have taken 5 minutes ago.
Right.
And I say, whoops, time for drugs.
Oh,
and
dear. Yeah.
I'd take more drugs.
Yeah.
And I'd be phoning my doctor. I'm out of my drugs.
Yeah.
He says, well, you've gone through 118 perks,
Yeah.
eh? Like in 3-4 days.
Yeah.
You know, like you need this care, you know.
Yeah.
So they got together and
Yeah. Is that why you ended up coming in here?
yeah.
Surface on board. Because in the Army, we have both tinsel bands. And my daughter was in one. I still have her tinsel. No, this is one I have in my office.
Lloyd, every time I go in there, he is so despondent. So despondent. He just, you know, everything's hopeless. He wanted me to, he got me real close. He whispered, I said, I can't hear you, Lloyd. So he whispered, he says, I want to give up. And then he asked for the vodka. Yeah, he wants to go. Yeah.
Okay, and he's wearing his outfit. Well, the result of this will determine whether you're going to be released or not. Is that
I
correct?
think so.
Well,
But I can decide that. If I want to be released, I can be released.
Yeah.
You
Is
know,
that
it's
something
not
you'd
up to
want?
them.
Well, I mean, you'd prefer
The
to
way
get
I
out,
am,
wouldn't you?
oh yeah, definitely.
Yeah.
I would.
Get out there and live.
Oh yeah.
Yeah, exactly. Well, I found a great place for you to live. We can go and see it actually this week. This friend of mine has the condo across the street that I told you about.
Yes.
So we could slip in, get the keys, have a look around.
Oh, that sounds good.
Check out the health club, which that's thrown
See,
in.
you're
1
like,
year
there you
of
are.
health club. There you go. You can be down jogging
Yeah.
and doing
Well, I
whatever.
don't think jogging, but exercising certainly. I'd like to get back into that if I can.
And it says that you appoint us to
everything you own.
No, this isn't the property one. We can do that after.
Oh, we can do the property one after. That's lovely. Okay, forget the
there.
property part.
No, this is for personal care.
You can divide that one up after, eh? Make sure they cut you in.
Right, all right. So here's what it says. It says, you give the people you've named the authority to make any personal care decision for me that I am mentally incapable of making for myself, including the giving or refusing of consent to any matter to which the Healthcare Consent Act applies.
'Cause I'm cuckoo.
If you get cuckoo. And any instructions,
God, that's
conditions, or restrictions contained in this form.
Yeah,
Okay.
or yeah.
Now, the one we talked about was like the living will, where you would decline or refuse artificial life support. Remember you said if you're gone,
Yeah, I'm gone.
you're gone. So that is an instruction, and once you write it down here, then even if you can't tell them what you want, we can tell them. That's
Yeah.
what he wanted here, here's what he told us.
You write it and I'll sign it.
Okay, well, let's just think about the words, because it's kind of important. Okay, you decline artificial life supports. I could put in quote heroic. Should I say heroic artificial life support? Like,
Well, you know, you should ask them.
substitute attorney.
3 guys died in here last week in this room here.
Oh, did they?
Yeah.
It feels okay, though. Doesn't feel like the other place, does it?
No.
No. The ghosts don't hang in here very much. I
No,
don't
they
think.
split. Oh, they're on top level. They're on the plane ride to heaven already. And
guess
I'm
'cause
on my
it's
way
easier
to
here.
heaven. Yeah, it's okay.
Oh, sorry.
Thank you.
Okay.
Huh? Yeah?
Feel sad? Yeah. It's okay, Lloyd. It's
It's okay to cry. You're giving up an awful lot. You know that where you're going, God will make it up to you, right? It's okay.
I said that
What do you want?
good salary as an executive really made a big so
Does he understand?
$400,000 a year.
Do you want him to leave?
He said
No.
he called me up one time and he said, remember
Do you
that?
need a prayer or anything?
Yeah. I paid that over taxes last year.
Okay, let's just pray together. Dear God, I come to you now and I bring Lloyd to you. He's your child and you love him. I just ask, Father, that you would surround him with your presence. God, you know how difficult it is for him to leave all those that he loves, especially Nora.
There's some benefit.
Go into your presence where there will be joy and love and peace forevermore.
Now, have you had a CT scan before?
Yes.
Okay. Have you had the IV injection before?
Yes.
No problems with the previous injections? Okay. All right, this way.
Do you have my requisition?
I do. Have you lie down flat on your back. Just making sure your feet are just at the end of the table. To wiggle down just a tiny bit more.
Should I take any?
No, that's
Nothing at all,
fine. That's fine. Everything else is okay. Now, as you know, the table is going to slide back and forth through the ring as we're taking pictures. Okay.
Cool. And of course, I've got the biggest spot.
You got the best spot?
Yeah.
You got the top bunk or the no, the bottom bunk?
No,
Oh no, this is your spot.
I'm on the edge here.
Cool. These are nice. Carnation.
Hey?
Carnations?
Yeah, yeah.
Somebody just told me they didn't like the carnation.
Yeah.
That's who's that?
Hey?
Who's this?
This is a girl I used to go with years ago.
Sheesh. You have to...
When I was in my spiffy days.
Wow. Should have held on to her, man.
Hey, I tried very hard, but I was pretty ornery, eh? And set my ways. And I'd come home when I'd come home.
How long ago was this?
In the 70s.
Wonder where she is now.
God, no. But I don't even know why I keep carrying the picture around. You know? But
it's part of you, man. It's part of your life.
Yeah, you get attached. Like of all the women I've gone with, she was the best woman I ever went with.
Well, hold on to the best memories.
Yeah. I got lots of them.
Yeah.
Good and bad. Some were rough and some easy going, but a lot of them were rough and rocky, you know?
Yeah. Yeah.
And so...
Well, it hasn't worked out too bad.
Yeah.
Well, so do you think you would want to go through chemotherapy again?
The way I feel right now, I don't.
Because you feel pretty good.
Well, no, not because of that. I just don't want any more chemotherapy.
No, I know.
Yeah. It's not a cure. And if I'm going to be living alone, then, you know...
You have to be well enough to...
Yeah.
Survive.
Even, he said he was going to give me a very small dosage, you know, on a weekly basis.
Well, if it was the difference between... If he said to you, well, this chemotherapy might give you the chance of 5 good years.
Oh, never. No, when it hits the organ, no. Maybe 5 months, but I would think that would be the most.
You know what?
If
you're feeling well, if I were you, I would get out,
Oh, yes, that's what I want to do. Oh, yeah.
Live, enjoy.
Oh, yes, definitely. Yeah. And then when my time comes, then fine. You know,
I mean, that's
I'll go do the rest of it.
In 602 bed 2, Lloyd Greenway, his condition really has sort of taken a nosedive this morning. He had a fair bit of pain. It seemed to be mid-sternal in the chest area on the right side, and it seemed to radiate right through to his back. And he's had some dyspnea with that, and is really quite distressed.
Okay.
I gave him an electric
Should we get your mom again? Yeah. Okay. Better.
All right. Okay. All right. Give me a Kleenex. Okay. You've got something, Pep, to go to sleep. You can let that out. Let it go. Let it go, dear.
Any of my friends know where I am?
Yes,
Oh, yeah.
everybody does.
Everybody knows.
You have a lot of friends in there.
You can play with it for 4 days and not
Really?
become addicted.
See,
But
I'm
after the
learning.
5th day,
I'm learning a lot of new
Yeah.
things from you.
but after the 5th day, you're a hooked a heroin addict.
So you
Okay?
didn't get involved in that
Oh yeah, I was in it.
you were.
I was into it for 40 years.
heroin.
Yeah, I probably spent a couple $1 million on my arm, but to try to find a vein in me. Like, see this one?
Yeah.
That one's all dried right out. Okay, like, and you could pump up veins here, you know, and not get them. Like the only one you're gonna get is my pulse. Okay, and
Your main artery. That's not a vein.
Yeah, but that's how people died, you know.
And how do you suppose you survived all those years?
Uh,
With all that abuse to your body?
I survived, I managed. Like, I think I've seen the White Tunnel twice. Okay? I just about come to death just about twice. And they revived me, but they shouldn't have.
They shouldn't have?
No, they shouldn't have. You know, because I'm only going to go back to the same thing, you know?
Wow. Well, you see, there's something bigger behind all that. Rick, there's someone else looking after you. Can't you see the... You okay?
It hurts to talk about it.
I know.
Just the memories.
Yeah.
Are you okay there, Rita?
Yeah.
I think it must have been quite well, it's been trying weeks for you.
Yes.
Waiting and wondering, and yesterday must have been quite an ordeal. But how did you think it went?
Well, I thought it went pretty well. I wasn't expecting any miracles. I was expecting bad news. It's just not knowing. I didn't want to spend another 6 months here, you know what I mean?
Yeah. What actually did he say to you?
Well, he mentioned that the best way to go is to take the oral pills, he thought, at this point in time.
How do you feel about that?
I told him that I would go for the oral if that's what he thought would be the best thing for me at this time.
Yeah.
I thought that.
Yeah.
Because I didn't want to take any more chemo.
Pardon?
I didn't want to take any chemo where I had to go in and have the injections. I didn't want that at all.
Okay? Just watch his hand. Or watch his knees and... Oh, sorry. Let me just put this in.
Janet?
I'll put the that pull-out bed because Norm is probably going to stay over.
Yeah, there's one out in the green one is out there.
Lloyd, you're in a new room.
It's a private room, okay?
Turn
So you're
this
by
one
yourself. So if you don't hear anybody else, that's why.
Just have a little chat for a minute.
Yes, you can.
Yeah. This is just a verbal report that we have. The written one will come in another couple of days. So this one is just very preliminary, but it shows a shadow on both lungs.
Yeah, so is that good or bad?
Well, we'd have to see the full one to see the exact extent of it, but if it's on a bit of difficulty on both sides, it may be that it's a bit worse than it was before. So we'll know a bit more when we get the complete one.
This is what I was concerned about the other day. I just got the bill back from the ODSP and to promote me or demote me from $966 down to $102 a month. You know? No. I can't live on that.
Yeah. Jody we'll ask Jody to talk to you about that, and she'll be better able to help you with that.
I might as well go back out to my lifestyles, you know, because this just ain't my lifestyle.
604 bed 1, Edith Simic, CA the breast with liver mets. Edith declined her PO meds this morning since she was waiting for her chemotherapy. We started her first dose at 1300 hours, and she will decide when to continue with her routine medications, which she may or may not decide.
Oh, there she is. How are you?
Okay, how are you?
Oh, I just feel a little pooped out.
Yeah?
Yeah. Pooped out in more than one way.
Yeah? Oh, really? Oh. Yeah.
I'm okay.
Yeah, they, at report this morning, they said you were feeling a bit down.
Yeah, I was ready to get up for a shower, and then all of a sudden I got sort of tired, you know?
Yeah?
So I felt I had to lay down and been laying ever since.
Yeah. Are you feeling a bit down in spirit, are you? Or?
Oh, no.
No? Oh.
I can't be smiling day and night here for the 3 shifts.
I agree with you.
You know what I mean?
Yeah.
I mean, I'm always trying to smile and keep my spirits up, but you get tired of smiling all the time.
Although it says very, very good for all those muscles that we have in the cheeks.
Especially the ones now that are really showing. Thank you for coming.
All right.
Can you tell me about your concerns?
Well, it's went down from $9.66 down to $102.
Right.
Now, a man that was living my expenditure, you know, and my lifestyle, like that's diddly squat.
Yeah.
You know? If I seen you open your bank wallet, you know, I'd probably break your jaw for it. You know? And I don't want to go through all that again.
No.
You know? And I'm getting sick and tired of this life. You know, like this, the way life is going.
How's it going for you?
Well, right now, not so hopefully, you know, because the way things are, you know, they're just not sailing, you know, like.
What is it that you need now?
I need some kind of security that if they put me out, they're not just going to put me out in the street.
We're not going to put you out anywhere,
No.
Rick.
No.
You know?
Well, I didn't expect it.
No. I mean, you're very appropriate to be here. Are you afraid we're going to kick you out on the streets?
No.
No.
If I go out, I just turn back into a mean animal that I used to be, you know? And I can go out in an hour and make $500-600, if not more.
Right.
You know?
Is that something you want to do?
No, I don't want to do that.
Ida Seamak, breast cancer, room 604. She had her chemo at 9 this morning, and this afternoon she called for Dr. Hegarty and said she didn't want to continue with that. So now it's been discontinued, that's a new order. And at 1:30 she was complaining of shortness of breath. She didn't want oxygen at that time, but wanted an Ativan, 0.5, which she had at 1:30 with good effect.
Very good, Velma. Velma can see a little bit out of the periphery of her yesterday we got her the wrong prescription with wrong blood initially. That's the right one. And it's over here. Okay, let's go.
I'm back. I'm back.
612 bed 3, Rick Pollard, CA lung with hepatitis C positive. At around 22:10, patient became paranoid.
Richard?
He packed his belongings and searched for his knives. He said he had 2 knives, and he wanted to leave. We'll call him Rick anyway. His name is Richard.
Careful, you gotta get back.
And around 2300, patient became paranoid again. He took off his gown and stood up and holding the bottle of beer and tried to bang against the window. And we called the security guy and we tried to ask him to come out. And he asked for smoke and we promised him to give him the smoke and asked to go to the bathroom. So we helped him to the bathroom and we got the bottle back. And I gave him a Nocinan 5 milligram sub-Q at 23:10 at that time. And after he went to the bathroom, actually he did not boil at that time. And then Anna went with him to the back lounge to have a smoke. And then later on,
We're here with you, Lloyd. Norm's here, Major Bobbitt. You're okay, you're safe. Read to you from John. You know where Jesus sat. Let not your heart be troubled. God, believe also in me, because in my Father's house are many mansions. If it were not so, would I have told you that I go to prepare a place for you? No, and if I go and prepare a place for you, I will come again and receive you unto myself, that where I am, there you will be also. And whither I go you know, and the way you know. For I am the way, the truth, and the life. No one comes to the Father but by me. Amen. Almighty God, we thank you because you are always with us. Even in the difficult times of our life, you reach out to us to comfort us, to bless us, to uphold us. God, we thank you for his life, for what he has meant to those who love him, for all the accomplishments of his life, the way that he served you throughout his lifetime. God, we would just ask now that you would surround him with your presence, with your peace, with your love. Oh God, even at this hour, may you make him aware that you are with him, that he does not walk through this dark valley alone, but he walks with you. And we just ask now that Lloyd would not struggle too long, but that he would just be able to let go and go into your presence where there is life evermore, where there is no more suffering or pain or sorrow. We ask these mercies in the name of the Father, the Son, and the Holy Spirit. Amen. Big loss for you, Lord.
Big loss, big time. It's a whole new life now. Complete new life now. A little late in life to be starting a new life. I said I'd always be there for him.
And you are. You've been wonderful with him. We should also have somebody so attentive to us at this time as you've been with him. We should all be blessed that way.
Lloyd Greenway has rallied. He's taking thickened fluids. He's verbalizing a little bit. There's been no seizures or congestion. And he's rallied.
This morning. My hands are cold.
Did you have a good night?
So-so.
So-so?
So-so, he says.
Yeah. Now, the nurses already fixed you up for the day, did they? Eh? You got an itch? We'll have to wait to see the nurses whether they want you to have something to drink or eat or
How
something.
would you like, eh?
You're cold and you're hot. Do you want a couple of toothpicks to hold your eyes open? Eh? What's the matter?
In room 614 is Rick Pollard with CA long, hepatitis C positive. His condition remains very poor within the last few shifts. He's deteriorated and his condition is very unstable. Though he's fairly rousable and fairly verbally responsive and less agitated. He remains congested plus, respiration is wet. He was maintained on oxygen 3 liters per minute by nasal trunk. He had no hemorrhoidal bleeds this shift. His wonder guard is working fine. He had a seizure in as well. At 1 a.m. this morning, he was suctioned for fair amount of...
Hey, Jen.
No, just come up my way here. You're going to sit down again on the bed. Right up like this, but you're going to bring your legs up onto the bed, okay? Let's wait for Allison. She can help.
Or do you want to go?
When you're done. You can get his legs in at the top. We're going to do a little pivot here, Rick. Ready? 1, 2, 3. Okay. There you go. You have a little rest now?
No problem. That was okay.
I just feel like I want to let go, you know?
You've said that before.
Yeah, I really do. Just want to let go.
I think that's changed since you came here.
It entered the liver, then I started to think that.
What do you think contributed to that sense of peace?
I think
Was there a sense of going back to your faith at all? Or?
Oh no, I won't be going back to my faith. Not to that denomination.
At least not the organized religion.
Yeah, yeah. I think It probably had a lot to do with my sister dying and the way she died and how long it took. I think that had a lot to do with it.
Did your stepsister come from California while your sister was ill?
No, she came
For the funeral?
She came for the funeral, yeah. We didn't know she was dying. She wouldn't tell us.
So I guess what I'm hearing about your stepsisters, that was a great disappointment for you.
Definitely. Besides everything else, but that to me was just unbearable.
Kind of final blow.
Yeah, that was a final blow.
That's kind of sad.
It is. I feel sorry for her more than anything else.
So Ida, I guess what I'm hearing you say, there's no second chance.
I can't give her another chance, not when I'm in this predicament, because I don't need it.
You're afraid?
No, I'm not afraid.
Of what she might do with it?
No, I want to frighten her.
You want to frighten her?
I want to frighten her.
How so?
I don't want her to be able to get in touch with me, and that keeps her worried, like she kept us worried since my sister died.
What happened this morning is he was actually fine. He kind of slept through the latter part of the night shift, basically up until 6 or 6:30, and then just when we were coming on to shift about 20 after 7, extremely agitated again, jumping out of bed. Like I said, it's kind of deceiving. He's very lucid. He's, calling us by our names right now and being Rick and making jokes and whatnot, but he'll literally kind of flip
right out
very quickly and start hallucinating and gets very paranoid and angry and doesn't know where he is. And it's that then we have to really act quickly. He's definitely regressing to parts of his past, and a lot of whatever happened then it's all coming out right now. He's talking about police and people that did him wrong, and very angry and very feeling like
Today. Lloyd, are you still having pain? The nurse is here. Can you tell her? Okay. She's going to give you some spray.
Okay.
Can you open your mouth?
Okay. Okay, dear.
Close it up.
Okay. Close it up.
Close it, Lloyd.
All right.
Good. That's good. It'll help your chest pain. That's a nitroglycerin. Doesn't taste great, but it'll help you, okay? You feel at peace, Lloyd? Do you? Do you feel at peace? Good. Good. So you got nothing to fear. What kind of a night did you have?
Rough.
Rough. How so?
I sleep in fits and furies. Wake up and lay there daydreaming.
Do you let the nurses know?
Yeah, I usually come up and get a pain pill.
Yeah, but what are you taking?
I'm taking Dilaudid.
Dilaudid? Or do you take
Yeah,
Percocet?
no, I'm taking Percocet too.
Well, it's okay to, but you need to take the Dilaudid. I think you get more pain relief from that than...
There's too much morphine. But it's man-made morphine, eh?
And what does that do to you?
You can get addicted to it too easy, like
Oh, Rick, you know what? You don't get addicted when you need it for pain. That's the truth. You don't need to worry, my friend, about getting addicted. That's the least of your worries right now. So you take the Dilaudid.
I'm taking them.
Because it'll control your pain better, and you mustn't let yourself suffer. You've had enough pain and suffering in your life. And it's not a concern. Our concern is to make you comfortable as possible.
I'm doing my best.
I know you are. You said you felt pretty down. Is it fear? Is it anxiety?
No, it's not the fear of dying. I've faced that too many times. Just the way I'm.
The way you might die.
I'd sooner go in a gun battle, you know. But this way.
Ida has taken a turn. She is angry underneath her confusion and exhibiting bizarre behavior. She doesn't seem to know where her legs are supposed to be. They feel like lead, she said. She's having a hard time taking medication. She looks quite distressed in there. Her phone drains out.
Ida, Dr. Haggerty here. Are you having any pain? All right. No need to sit up. It's all right. Okay. Are you having some pain? All right. I'm just going to take a little listen here and a little look. Is that all right? Just want to take let me just heat my cold. First, we just take a small listen here. Okay, that's good. Right. Just take a listen. It's okay. Okay. So, how long do you plan to be here for?
It doesn't make any difference.
No? Okay.
It's just that I'd be here for a while.
Okay.
I need some rest. I've been going all day here.
Have you? Okay. Are you staying somewhere?
Across the street, Marriott.
Oh, good.
Yeah,
Okay.
yeah, I'm all set there.
Okay.
You know who this is? Hmm?
Lloyd has not had a very good evening. He was quite tremulous and agitated at 16:30. Midazolam 5 milligrams sub-Q was given at this time with effect. He was complaining of cramp-like pain at 17:30 in his right leg and in his abdomen. Morphine 3.75 milligrams subcutaneously was given with excellent effect. This held him to about approximately 8 o'clock or a little bit thereafter, when he again became quite restless and distressed, actually very distressed. He was holding his right chest and his leg and also rubbing.
Yeah. So what's her sister's name in California?
Polly.
Her half-sister? Polly.
Pauline.
Have you talked to her of late?
Oh, oh yes. She
Mm.
calls about once every
Week?
6 weeks.
Oh, 6 weeks.
She's very sad about.
Does she know at this point that he does this poor?
Yes. See that they catch me in the middle.
Yes, of course. You're being tugged.
Yeah, I see.
Someone on each
Polly's
hand
over
pulling
here,
you.
and
Ida's on
Ida
that
would
hand.
say, "Well, why don't you tell her this?" And I says, "I'm not going to tell her anything, Ida." I said, "If you want to tell her anything, here's the phone."
Yeah. She felt somehow that she ignored Frida and you when Frida was so ill.
Polly came as the best she could. That's a long way from California.
No
She was the
kidding.
next day, you know. And not only that, she had to find her own way. There was
And when Frida died.
there was no way, nobody to pick her up, and she said, "Oh, I'll do it on my own." I said, "I'll have somebody there meet you." No, never mind. But she came on her own, suitcase and all. And she came the next morning.
I guess it was after. She never contacted her for a long time.
That's true.
She said she felt she's forgiven her, but just because she's forgiven her doesn't mean she has to carry on with the relationship.
That's right. Yeah, you have to forgive.
Yeah, and she felt she has forgiven her.
Yeah.
Rick has some edema, dependent edema in his hands. He's semi-responsive. Dana was in this morning and saw him and was wondering whether we could lighten him up a bit. And I said for the safety of the patients and for himself, it's too risky. Too risky.
We thought we might risk leaving Chloe in there. I think he's
Might be more comfortable for him.
Okay.
Going home to be with the Lord. Going home to be with the Lord. You're just leaving this old shell here. Thank you, Jesus. Thank you, Jesus.
It's okay, Daria. It's okay. I feel so comfortable right now. I don't know what happened.
Yeah.
I just know he is so fine.
Yeah.
It's okay. He's okay. He is so confident. I'm okay, Marion. I've had my cry with him, and all of a sudden a peace come over me.
That I cannot believe you. I am so calm.
Singing today at the church.
No, because I know where he's going.
Okay, baby.
Okay, babe.
Go be with Grandma and Granddad and Jesus. Okay, baby.
You're gonna be okay.
Go with Grandma and Granddad and Jesus. Mm-hmm.
Yeah.
Okay. Okay.
Everything is gonna be fine, babe.
Okay, honey.
They told me they were giving him medicine on a diffuser.
They've got something.
Oh, going in by IV. Did you speak to him yesterday?
No.
Did he speak to you?
No. I think when Graham and I were here this morning, he wiggled his eyebrows at us a couple times.
He did?
Yeah.
This morning?
Yeah.
Oh, that's good.
I think he recognized us, but that was about it.
Strange, but he looks better to me than he did when I came in. I guess it was last Saturday. Looks like a Renaissance painting.
Right.
He looks like a Renaissance painting. The agony of Rick.
I'm going to go home now. I'm going to leave you in God's good care. And when it's time to go, you'll go and be with Him. My friend, I just pray that the angels will line the path as you journey from earth to heaven. Oh God, I just pray now that you would be with Ida, very close to her, surround her with your presence and your love. May she feel that in her very being and her spirit. May she feel safe as she leaves this earth and goes to be with you in your kingdom of love and peace and joy forever. God, we thank you for this person and for what she has meant to us as we've journeyed with her over these months. Just bless her now, God, and help her to let go into your arms of love and into your presence forevermore. We ask this in Jesus' name. Amen. Good night, my friend.
Hi, George. Hi, it's Dana calling. Rick's condition took a turn for the worse last night, and he's been kind of getting steadily worse. Today he hasn't really been responsive, but his breathing is very labored. Yeah, so it seems like he's probably not going to be with us too much longer. Is there a chance that you would come tomorrow? That's right. No, it wouldn't be a good idea. So if that snowstorm does come, I would agree with you that there's no point risking.
We're all with you. We all love you. Mm-hmm. You know, Jesus wants you to go and be with Him. Okay? okay?
Dying's very hard work. Dying's very hard work. It's like going through labor. If you remember. Right. Very similar. Giving birth to new life.
Okay, babe, let it
Push that down.
I'm
going to be okay. Don't worry about me. Don't worry about me. I'm going to be fine. You know what a strong I am. I'm going to be fine. I've got David. I got your mom and dad. Don't worry about me. I'm going to be all right. So just let me go, babe.
Let it go, dear. Let it go. Let it go. We're all together. Let it go.
Richard. Thank you, Richard. God bless you. You've suffered. Yes, he has.
That was quite the struggle, Rick.
Yeah.
Not too bad at the end, though.
Yeah. Yeah, he went peacefully. But you did struggle. But now you're free of pain. You just lower his head. We'll just see what he says I want to put this
Another one of this.
No, they were down the hall. But I mean, he just stopped breathing. That's all that happened.
Richard. There you are.
No. Yeah, they're right here right now.
I think it's okay.
You want to try it?
Yeah. I'll just use my stethoscope. That's good. There we are. Okay. I'll come and pronounce him. Okay?
Yeah. Come on, buddy. Here's the one last ride.
Thank you.
You know, things have been much the same for the last couple of days, but I just wondered, do you have any questions or?
I don't have any questions. I understand that she's failing rather
quickly.
Yeah, she looks comfortable.
Mhm.
The noisy breathing is
Filling
is
up in her
not.
chest.
Yeah, it's not really bothering her. It probably sounds worse to people around her.
That's right.
She looks comfortable right now. She doesn't look like she's in pain. She looks a little bit less restless than she looked yesterday or the day before.
Mhm.
So that's good. But I think we're just going to continue along with what we're doing, and we'll just go from there. Okay.
Let's share together in the 23rd Psalm again, okay? The Lord is my shepherd, I shall not want. He maketh me to lie down in green pastures. He leadeth me beside the still waters. He restoreth my soul. He leadeth me in paths of righteousness for his name's sake.
Okay.
Yea, though I walk through the valley of the shadow of death, I will fear no evil, for thou art with me. Thy rod and thy staff, they comfort me. Thou preparest a table before me in the presence of mine enemies. Thou anointest my head with oil, my cup runneth over. Surely goodness and mercy shall follow me all the days of my life, and I shall dwell in the house of the Lord forever. There is a change.
Yeah.
Definitely. Yeah.
It's okay.
It's okay, Lloyd.
It's okay, baby.
Just go home with God.
Much better place.
It is indeed.
Much better place. Don't need this aggravation.
God bless you.
It's okay. Let him go, Marion. I'm happy.
Yes.
No more suffering, no more pain.
He went in just at that minute, didn't he?
No more suffering, no more pain. It's okay.
That's okay.
Okay.
It's okay.
Oh, dear.
Hi, baby.
He's at peace.
Bye.
Yes. He went so peaceful.
He did. He did.
Bye, baby.
Yep.
Don't worry about it. Remember what I said. No papers all over your mansion. Remember that. You remember that. No pack ratting up there. No.
Okay, baby.
I love you.
You took the trick. No. Thank you. You're welcome. Thank you very much.
It's okay.
Yeah, it is okay.
Much better.
Yep.
Let's go to a far better place than this place.
Yeah.
It's okay to be with him. Because we're good for him.
So we're burning off
Right.
your
We're
shoulders.
for him. That's right.
Mhm.
Yeah. He's had such a struggle.
Oh, is the other.
It's so beautiful how he's so calm and just.
Yes, just this one. Just
Thank you. Thank you. Thank you.
Phyllis wants to be here. She should be here.
It's too early, I think. I don't know. She doesn't want to come. I know we're not gods.
I know.
Okay, but I will give her some.
Mm-hmm.
Yeah.